Hi, my name is Jennifer Kranjec, and I'm an online hypnosis practitioner, and I help people in the surgical, medical, and healthcare communities live healthier, happier lives. Now, today, abuse is actually something that is growing, it seems, in the healthcare world as well as in the public arena. You're seeing road rage, you're seeing bullying online, it's escalating in the schools, it's even being found in the grocery stores. And of course, when you're working with people in the public coming into the healthcare world, such as hospitals or doctors' offices, and it's something that can really wreak havoc with a person's mental health. You feel disrespected. You feel like you don't have the empathy anymore when you are constantly being hit with an onslaught of slurs or aggression from somebody that you're trying to help, or a family member of somebody that you're trying to help. And it can really do a lot of damage. And with this, over time, it can really escalate to the point where you feel like you don't want to go to work anymore because you're tired. You're tired of being treated like an afterthought, and that disrespect is bringing you down. And you have to put a smile on your face, even if you don't feel like it. You have to be polite. You can't get mouthy with somebody. You can't really fight back because you can lose your job. And you are supposed to be the authority. You're supposed to be the leader in the matter in which you're dealing with a patient, and it can be very, very difficult to put that happy face on, especially if you've just had an earful or you've actually been physically assaulted by somebody who is just angry and out of control. Maybe they're coming in and they're on an illegal drug or something like that, and they're lashing out because they're in a rage for some reason. And to put that happy face on and then go see another patient right after dealing with that, it can really bring you down, especially when you're trying to smile your way through it. And it is very, very hard to do because it affects your self esteem, and it affects the decisions that you make, because it actually produces a thought loop that's negative, because you can't really just snap out of it and forget it because it hits you on a personal level. Even if you're acting the role of, water off a duck's back, it really doesn't. After a while, it really does start to sink in. You start to become not so bulletproof anymore. And over time, it can really cause a lot of damage. It's incredible. And also, I should say, with the amount of stress that's actually happening on the job, because you are dealing with trauma, you're dealing with people who are frightened, so when you're adding all of the other aspects of the other patients that you are working with on top of the abuse that you may be experiencing with some of the people that you're meeting day to day, maybe treating you as if you are, a servant, or the concierge of a five-star hotel, it can really, really wreak havoc with you. You're going to find that you might be, isolating yourself. You're not as social because you don't feel like being social, because you're feeling down in the dumps. You're tired of this. You go home and you're not sleeping. You're replaying this scenario that maybe happened that day, or scenarios if there was more than one, in your head, and you're looping it while you're lying in bed and you're thinking about it. Maybe you're dreaming about it even. And then you're also thinking, well, the scenarios that could have happened. If I had have said this, maybe it would have stopped that. Or maybe if I behaved this way, that would have happened. Or maybe if I didn't go into that room, this wouldn't have happened to me if I let somebody else deal with that patient. And you go through all of these things in your mind, but the problem is that's the damage right there. That loop is of thinking, and the fear of walking into a room because you don't know what's going to happen, whether they're going to be super friendly and appreciative and polite and respectful of you, and being grateful that you're there to help them and to care for them, or whether you're going to just get hit with this onslaught of disrespect, and you don't know what you're doing because I saw something online and I know better than you, and wait till I tell your superior, or I want a second opinion because I don't think you know what you're doing, even though you have all the experience in the world and you've been training for years and you've dealt with situations before. It can really, really start to build. And what happens is with this abuse, and you full well know, being in a medical profession, when somebody's abused over and over, it really affects your self-worth. You end up with imposter syndrome. Your self-esteem is going to actually start to plummet. And over time, it's just going to get worse. and worse, and you're going to feel less energy. You're going to feel less humanized. It might even affect those personal relationships that you have. Maybe you can't wait to get home just to get away from work, but when you're not home, maybe there's an argument because you weren't there for a reason, or you didn't answer your phone at the right time, or whatever the relationship problem might be. If you're experiencing something like that, also as a side effect from the kind of work that you do and the long hours that you have and the stress that you're under, everything will kind of come to a blow. Now, down the road, it will affect your relationships. It's going to affect you being able to fight back. Maybe it'll actually cause you to have a complete nervous breakdown. That can happen. You're crying alone in your office or in the bathroom, or you come home and you just shut the door and you don't want to talk to anybody because you've had enough of people for the day and you don't want any more stimuli coming at you, because you just need to put a stop to everything and just come down and unwind. And it grows and it grows. With the type of work that I do as a therapeutic hypnotist, I work with people to help de-escalate that kind of stress and strain and allow your mind to heal this and give you better coping mechanisms so that when you are in a situation, you're not going to be able to feel that stress happening. You're going to be able to take it with a grain of salt. You're going to be able to have the right words at the right moment when you need them without escalating a situation, and help you actually walk away from the situation after it's finished and be able to recover from it, knowing that you're okay, and then proceed with your daily routine of going and seeing your patients and caring for other people. It'll actually improve your sleep. It'll improve your relationships. It's going to give you more motivation on the job. It's going to help you so that you can focus on your job, so you don't make those errors, so that you have clear thinking when it comes time for critical decisions. And if you are more interested in the type of work that I do encourage you to take a look at my website to see how we can offer you rapid results that will last for a lifetime and get you back on track and feeling a whole lot better, because abuse is never your fault, no matter what. And I also have a lot of videos that explore other areas around the healthcare community, and issues that might be something that are showing up in your life as well, and how hypnosis can actually help with that also. So if you would like to book a free online consultation with me, it's over Zoom, as are my sessions, because it doesn't matter where you are in the world. I can meet you online, and we have our sessions there in the privacy of your own home. So you can be at home, you can be in your office, and it's a completely 100% confidential service that I offer. So if you have any questions, I would love to hear from you, and please reach out and connect. And that is all I have for today, and I hope you enjoyed the video, and I'll see you next time.